theme song. Okay. Thank you guys so much for having me. When Coach Rose reached out and asked me to speak about hormones, I was really excited because this is a topic I haven't gotten to speak at a conference about yet. I speak at a lot of women's conferences, and I'm always open to whatever my ask is, if it's something in my area of expertise. And my first hormone talk, this is it, you guys, and I'm really excited about it. I'm asked so much about it. Those of you who don't know me, I'm Dr. J. I'm a family medicine physician. I'm the founder and medical director of Inspire Primary Care. We have a private practice on the southwest side of town. And I grew up here in Las Vegas. 4 years old, I started saying I wanted to be a doctor, and I grew up not experiencing quality healthcare here. And my mission became to finish my training. At that time, there were no medical schools or residencies in Las Vegas. So I knew after my 14 years of training out of state, I wanted to come back to my hometown and provide quality healthcare to my hometown. And it has been literally my childhood dream come true for us to do that at Inspire for 4 years now. So it is my honor to be here with you all today and to be in a room full of powerful women. This is my kind of room. So thank you guys for having me today. All right, so here's the question I'm asked the most, and it is by women, and it is, do I need my hormones checked? Okay, how many times? Has any of us thought about that or wondered that? I mean, raise your hand, it's a safe space. All right, do I need my hormones checked? And a lot of times when women come to me at our private practice, they want to know, do I need labs ran, right? And so a lot of things that come to mind is that women are bombarded with lots of things, right? We are looking at TikTok and what are they saying is the right thing? We hear our friends girl, what are you on? What's your hormone doctor got you on, what's your stack? What's your, and then you see women that you idolize or that you're like, man, she looks good. She says she's feeling youthful. What's your fountain of youth mix, right? And then we've got ChatGPT and we're like, yo, what do we need, And so I'm like the ChatGPT girl, don't judge me. So I'm like, what do we need? And then we got Oprah. And she's got her special, right? And we're like, girl, what do you think, Oprah? And so we've got a lot of things going on. And if you go to doctors, you go to one doctor, you're going to hear one thing. You go to another doctor, you're going to hear another thing. You go to another nurse practitioner, you're going to hear another thing. And that is because what I've learned about women's health and being an expert in women's health now, it wasn't from my medical training. They glance right over it. They give us one cookie cutter way. They talk about estrogen, progesterone. Here's how you treat it. Boom, bam, on to the next topic. So I became an expert in caring for women well through caring for women just like you. From hundreds of women at Inspire Primary Care, being with them and sitting with them and hearing their stories and hearing how it's actually impacting their day-to-day life. To hear about the stories of women who are drenched at night, having to change their sheets every night, where their husbands are like, please go see a doctor, girl, because something's different about you. Where she's like, I feel, this brain fog sensation. I feel like I can't concentrate. And obviously we all know the hot flashes, right? So it's really about hearing the stories, having the time to listen, and then partnering with women to come up with a customized solution. That is how I became an expert in women's hormone health, okay? So here's the truth. There is no one-size-fits-all way, and that's what's frustrating, because we will hear about our girlfriend next door that has this great sensation and she's feeling amazing, and we're like, just give me what you got. Or you'll hear about someone who went to a specific doctor's office and they're like, they gave me this and I feel better, and you're like, okay, cool, do the same thing for me. Or you'll go on TikTok and they'll say, go to the gray market, order these peptides, and you'll feel great. And you're like, okay, well, let me order that. And so the frustrating part about this is there is no one size fit all. Look around this room. Look how diverse, beautiful individuals that we are. Your genetics are different from the woman next to you. Your family medical history is different from the woman next to you. Your age is different from the woman next to you. And your personal symptoms are different from the woman next to you. So that's the part we can't skip over, is we really need someone who can partner with us well and customize to us as individuals. And that's the part most women don't want to hear, all right? They're like, give me the quick thing, the quick fix, and let's go. All right, everybody should have, we're gonna make this interactive, okay? All right, so everybody should have a postcard, all right? On the right, it says Inspire Primary Care. On the left, it says, do I need my hormones checked? All right? When I first started getting that question all the time. I used to be like, oh, here we go. But now I love it because now I'm able to really partner with women. So does everybody have it?
Yes.
All right, we're on the side that says, do I need my hormones checked?
Yes.
All right, we all have a pen?
Yes.
All right, let's take a couple minutes. DJ, do we have a little music? We'll just like give it 1 minute. Just circle all the ones that are a yes for you right now in this season you're in right now. So it's just a few questions. All right, it's your personal business, okay? We're not cheating off each other's sheet. But just circle any of the ones that apply to you right now in this season. All right, and that should take just about a minute, so I'll pause. Does anyone need more time? I was that student in class that liked to finish first. Done! Do we feel ready? Are we good? Okay, we're good. Thank you, DJ. All right, I didn't prepare anybody for any of this, so thank you. All right, we're flowing. All right, so we got those answered. So we don't care about your personal business, all right? If you meet me in the office, then I want to know your personal business. But for now, we have our sheet, our little card in front of us. I just want you to raise your hand. If you circled one thing on your card, can you just raise the hand high? Okay, cool. Keep your hand up if you circled 2. Keep your hand up if you circled 3 or more. Okay, so look around. That's why we can't just take one cookie cutter answer that what friends have, that TikTok has, that whatever has, and say, boom, that's for me, because we're all so different. How this experience is through our hormones is different. So I'm gonna get a little nerdy for a second, okay? I like to be cute and like a normal person, but I am a doctor at heart, and I really do nerd out on physiology. So we're gonna do a little high-level physiology. My thing that I love is taking something that's really complex and like breaking it down easy, okay? Like ABC 1, 2, 3. All right, so let's talk a little physiology. A lot of times when we hear the word menopause, these days, it has been villainized. It has been this horrible thing that's lurking for women at middle age, and everyone who's gone through it is terrible. It's terrible, it's horrible. Like that is what we're being prepared for in our media. And that is not necessarily true. And for most, that's not true. So I like to break it down literally as seasons of life. Say that with me, seasons of life.
Seasons of life.
All right, doesn't that sound better? Okay, so I like to break it into 3 seasons of life. We have childhood, all right? I believe we've all made it past that season of life. All right, then we have the childbearing season. Say childbearing season.
Childbearing season.
Women get the joy of getting a childbearing season, all right? Men don't get to experience that joy, but we do, right? And so in our childbearing season, most of us will have a menstrual cycle each month, and each month our body is wondering, are we gonna have a child, right? And so we're preparing, our estrogen is fluctuating, our progesterone is fluctuating, in preparation for the childbearing season. Of course, there are outliers, women who have irregular periods. Of course, there are outliers, women who have had hysterectomies. But we're talking about women who have normal menstrual cycles every month. All right, that's our childbearing season. Number 3 season is our non-childbearing season. I know, I made it really complex. So say non-childbearing season.
Non-childbearing season.
Doesn't that sound better than like menopause? Right? It's literally just we are either a child, or we are in our childbearing season, or we are in our non-childbearing season, all right? And either, all the women in here are either in their childbearing season or their non-childbearing season, and then there's a little bridge where we tiptoe from the childbearing season over to the non-childbearing season, and that transition is perimenopause. So when you hear people come and they come to me and they're like, am I going through peri? I'm like, that's literally just the transition from childbearing season to non-childbearing season. My husband said something funny to me the other day because I was preparing for this menopause talk, and he gets the pleasure of like hearing my practice. And he was like, why do they call it menopause? Men have nothing to do with it. And it made me think, like, well, actually, I put my little nerd hat on, actually, it's about the menstrual cycle. And all it's saying is that the menstrual cycle is going on a permanent pause. And then I was like, oh, that's good. I didn't watch that. I was kind of proud of that. And so literally, I was like, I'm gonna share that with the women. We are either in our childbearing season, having menstrual cycles, we are tiptoeing to the non-childbearing season, where it starts to get irregular, that's perimenopause. And then once we have had no menstrual cycle consecutively for 12 months, We are officially in menopause, where our menstrual cycle has gone on a permanent pause. And we're now in the non-childbearing season. Did I break it down simple enough?
Yeah.
Like, it's so simple, but we make it so complex and ugly and frustrating, right? So why is that? That's because how that transition from childbearing season, tiptoeing and perimenopause over to non-childbearing season, how that makes us feel as women, as our estrogen starts to drop, as our progesterone starts to drop, as our testosterone starts to drop, as our insulin resistance picks up, how that impacts us as women individually varies so much person to person. You have the women who have no symptoms from that transition. You have on the other end of the spectrum, women who have debilitating symptoms from that transition. And then most women fall somewhere in between, where they may have mild to moderate symptoms. And that is why everything has to be customized, because how does that transition impact you as an individual? Make sense? Okay, so now let's talk about what a lot of women ask me about, labs, okay? Do I need my labs checked? And so the answer to this is maybe, like I should get every adult that comes to see me in the primary care office, there are certain labs that I should see for every adult, just because I need to know your metabolic history. I need to know about diabetes, thyroid, your liver and kidney function, right? I need to know if you're anemic with a CBC. There are certain things every adult I just need to know. But then from there, I need to actually get to know you, your history, your family medical history, and then customize if there are any additional things that should be done, like an iron panel, like what else? Like vitamin D, okay? Vitamin B12, like that should be customized, all right? Estrogen and progesterone and testosterone included. It should be customized and personalized. Not every woman that comes through my door needs their hormones checked, just like not every person that comes through my door needs the same set of pills, all right? Or any at all, all right? Okay, so cookie cutter recommendations is a red flag. If you go somewhere and they say, pay me money, you get these pills, that is a red flag. All right? It's not the sexy thing to say, but it's the truth. All right, y'all hanging with me?
Yeah.
Okay, so who wants to know the truth that most of us actually do need for good hormone health? Okay. Okay, trigger warning, it's not the sexy answer, okay? It's not the TikTok answer, but it's the answer. It's the 4 pieces that are truly the secret sauce to hormone health and to longevity. All right, say 4 pieces.
4 pieces.
Secret sauce.
Secret sauce.
All right, number 1 is nutrition, all right? So what do you guys think the ideal nutrition for hormone health and longevity is?
Protein intake.
I love it, protein intake. Balanced blood sugar, okay, what else? Fiber, love it. Water, yes. Anything else? Is it starving ourselves? Is it depriving ourselves from things we love? Okay.
Is caffeine anywhere in there?
It can be, right? And so I like to really, again, break something that can be complex really simple. I'm like, man, if I can't just rattle it off to you quick, don't tell me about macros and weighing and this and that. That can be important, right? Because again, everything should be customized. So if you have specific goals, you're training for weightlifting, you're trying to gain muscle, you have certain sensitivities, you have certain allergies, right? Then everything still needs to be customized. But here's how I like to break it down. Most women will have excellent hormone health and longevity in their nutrition if they eat a lean and green meal. Can we say lean and green?
Lean and green.
A lean protein and a non-starchy vegetable as the foundation of their plate in most meals. It's not the sexy thing to say. Plus or minus a healthy carb, plus or minus a healthy fat, plus or minus a nice little caffeinated beverage from time to time. But if we have a non-sugar beverage, all right, non-alcoholic beverage, sorry to say, and a lean and green meal as a foundation in most of our meals, girl, you're set, okay? And then customize and treat yourself from time to time from there. But the part that most people miss is what is the foundation. We're looking for the fancy recipes, we're looking for the fancy things, the trends, and it's really lean, green, plate. Start there, move on. And treat yourself too, based on your goals, right? Okay, because I love a Baskin Robbins from time to time. I love a box of Milk Duds once a month, okay? But it can't be my norm. All right, so number 2 is physical activity. Say physical activity.
Physical activity.
All right, so what do we think an ideal physical activity would look like to support our hormone health and longevity?
Resistance training.
Resistance training. We got an A student over here. All right, what else?
Rose's Gym.
Walking. What's up?
Rose's Gym.
Roses.
Yes. Well, if you go to Rose's Gym, Coach Rose is going to tell you to pick up those weights, okay? Which is the correct answer, right? So, again, we get really complex. How many hours a week? Da, da, da. I'm like, okay, if you are, okay, I break physical activity into two things. Movement, all right? Our goal is to decrease being sedentary. All right, so that's parking a little further, taking the stairs instead of the elevator. If you're at a desk all day, all right, when you have breaks in between your meetings, take a little walk, do a little plank, do a few crunches, moving, okay? Movement throughout the day, trying to decrease how sedentary we are, followed by exercise most days of the week, scheduled exercise. Yes, sweeping your house is nice movement, but that is not the same as scheduled exercise. And we want the emphasis to be on resistance training. All right, so important for women, all right? So the weights are the queen. Cardio is cute. You got it? Okay, all right, number 3 is quality sleep. Say quality sleep.
Quality sleep.
Most of the time when I hear women talking about their mood, their fog, their brain fog, their concentration, my next question is, girl, how's your sleep? All right? Because that affects almost everything when it comes to our health and wellness, a quality sleep regimen, all right? And a lot of women need to be screened for sleep apnea, all right, which is something that's glazed over. So, number 4 is gonna be stress reduction. All right, so I'm like, what is your stress reduction like? What is the stress like in your life that increases our cortisol, that makes it harder for us to lose weight in our central, we increase central adipose tissue or fat in our stomach, okay, if we have high levels of stress. So these are the things we're talking about. If we can get those 4 things down, our nutrition, lean and green meals, our physical activity, movement with resistance training, a quality sleep regimen, and our stress reduction where we're really focused on joy, peace, and contentment, spiritual health is also important, okay? Then that is so underrated. Like, we don't want to talk about, are you content? Are you joyful? Are you peaceful? Like, but that is the part that really is impacting a lot of aspects of our health and wellness. And I know you're like, man, I didn't come here for this. I wanted to hear about that HRT. But this is the foundation. This is the foundation. This is the foundation, okay? It's the non-sexy thing that they're not going to TikTok about your lean and green meal because that's not going to catch your attention and keep you binging, all right? But it's also the thing that's going to transform your health. Okay, you guys are sticking with me. We made it through the foundation. That's the most boring part. Okay, supplements. A lot of people ask me about supplements. I'm going to keep it simple here. The main thing there is works for some people, doesn't work for some people. It should be customized. There should be a trial. You should talk to your doctor. At Inspire Primary Care, we have an evidence-based supplement library, and we customize those recommendations based on what you're going through. Okay? All right, I'm going to move to HRT really quick, hormone replacement therapy. The main thing to know here is it's not for everyone. It's not necessarily a bad thing or a good thing. We need to know your symptoms. We need to know about the foundation that we just talked about, and we need to know your family history, your medical history, talk about the risks and benefits, and customize that recommendation to you. All right? It is not meant for an anti-aging fix. It is not a fountain of youth that it can be promoted as for trends. Okay? All right, so the core message in summary is that there's no one-size-fits-all recommendation, all right? It should be personalized with a personalized wellness plan. You should have a personalized management plan if management is needed. And a healthcare home is needed with a personal healthcare team. Raise your hand if you do not have a healthcare home and a personal healthcare team that is easy to reach, easy to text, you can get in, they're listening to you, they're not rushing you. Raise your hand if you do not have that. Okay, all right, so we want to fix that because that's a part of the foundation, okay? And of course, shameless plug, Inspire Primary Care would love to be your healthcare home, okay? All right, so last thing, as I close, move to the back of your card, flip it on over. There is a QR code there because what is the name of this talk? Do I need my hormones checked? So our gift to you, if you scan the QR code, we are going to give away, there's quite a few women in here, so we'll give away to 3 winners a free comprehensive lab panel, and that will include a full hormone check, and we will review it line by line with our provider team. So any woman in here that enters that today, scans that QR code, puts your info in, our team will call you Monday, all right, and give that away to 3 women. Last thing, anyone who joins our practice in the month of April, we will waive your enrollment fee if you join as a monthly member. If you join as an annual member, we will waive your enrollment fee and give you 2 months free, okay? So that's for you, family, friends, anyone who mentions this conference. So you're not crazy, we're in this together, and thank you so much for having me.
Don't leave, don't run away. Do we want to do a Q&A? We have actually 10 minutes that we planned for
I'm
that.
happy to.
Yeah, okay, so I'll walk around. Who wants to go? Okay.
I'm gonna couch it out.
Yeah, you can couch it out.
All right, Dr. Norris. Question for you. I get this, I'm also a transformation coach, so I get this a lot from women that, oh, my doctor told me my labs are normal or they're in clinical range. Now, there's a difference between clinical range and optimal range. In your practice, do you want to explain that? Because I know a lot of other women aren't familiar with that understanding and hearing that normal from their doctor.
Yes. That's an excellent question. Thank you for asking that. So this is why I try to emphasize that when it comes to hormone health, it's really about your symptoms more than it is about labs. So when women come to me and they ask if they need their hormones checked, my next question is about what symptoms are you experiencing? Why do you think your hormones need to be checked? Tell me what's going on. Because what we're trained on is that the history is what gives you the diagnosis, right? A lot of women are like, do I need my hormones checked? Am I going through menopause? My question is, have you had a menstrual cycle in 12 months? No, I haven't had one in 2 years. You went through menopause a long time ago. So we know that, right? But when we talk about lab work gives us details on where you are physiologically, metabolically, and it also gives us information on how we would manage symptoms. If we do start you on HRT, I need to know your estrogen, progesterone, testosterone levels, so then if I'm giving you estrogen, progesterone, testosterone, I need to know if we are staying in a healthy range. The thing about the labs being normal is if you are a woman who has already gone through menopause and I run your estrogen, progesterone, testosterone, all it says on the results is if your number falls in a childbearing age woman range or a non-childbearing woman age range. So if you haven't had a menstrual cycle in 12 months and your estrogen, progesterone, testosterone is low on the labs, then I'm like, yep, it says you're in menopause, which is normal for a woman who's in menopause. So, but that doesn't mean that you're not having symptoms. So that's why when women ask me about checking labs, I let them know up front, we do not need to check labs to discuss what a custom management plan will be. It will just let me know if you're in menopause or not, and I don't need labs to tell me that. But other labs like, do you have diabetes? Do you have a thyroid disorder? Do you have this other metabolic issues that are contributing? Do you have a vitamin D deficiency? Okay, well that may be the contributing factor to your fatigue and your sleep. So yes, so important to know. A lot of people think the labs makes the diagnosis when it doesn't.
Thank you, that was amazing. Who else? Who has another question? There is no way nobody has questions. Okay, I'm coming.
I mean,
Oh, I'm gonna get some exercise today.
Dr. J, you said you could do memberships with Inspire. Can you talk more about that?
Sure. I didn't pay her to say that. But excellent question. No, so a lot of people anyone familiar with membership medical practices? They're becoming more popular. The reason that many physicians are leaving the insurance-based practice is not because we want to charge you more or because we don't want to take your insurance you pay for. It's actually because if we work for an insurance-based practice, doctors have to follow insurance companies' rules, and that means we're required to get in and out of the room within 5 to 8 minutes or we're fired. We're required to have appointments double booked, just in case one doesn't show up, which is why you're waiting hours. And the insurance company assigns every primary care provider 3,000 patients. So while you're calling, 3,000 other people are calling, which is why the average wait is 3 to 6 months in Vegas to get in with an insurance-based doctor. So that's miserable for the patients, that's miserable for the doctor. Doctors are forced to either give a pill or a referral. Best doctor, smartest doctor is gonna have to give you a pill or a referral if I'm only allowed to see you for 5 minutes, okay? So the answer to your question is many doctors are leaving and doing a membership-based practice. Doesn't mean it's more expensive. It just means that most people are customizing their insurance to high deductible health plans with an HSA. HSA dollars can be used towards membership. Some people just pay for the membership. And then we also partner with brokers who can build us into health plans. And we are also the healthcare benefit for many small and medium businesses in town who offer it as a benefit to their employees. So lots of ways to make it really affordable. And we offer virtual concierge memberships and specialty memberships that do medical weight loss hormone management as well.
Thank you.
Do you take Medicare?
So you can have any insurance or no insurance and join our practice. All of our services are through membership. If you have insurance, which most of our patients have some sort of catastrophic plan, you can use it for the 10% of care that falls outside the primary care office, like labs, meds, imaging, etc. But our wholesale rates on labs, meds, and imaging are gonna be less expensive than using your insurance.
Mammograms, are they included?
That's a great question. I'm loud. You guys can hear me? Okay.
I'm gonna actually find out.
Okay, are mammograms included is a great question. So you can think of a membership medical practice kind of like a Costco, because if you are a membership practice, we can go directly to the labs and the imaging centers and negotiate the lowest cash rate without insurance markups. And so the answer to your question is mammograms at my practice. If you use your insurance and you want to use your insurance, you can. But if you don't have insurance or you want to know our wholesale rate, we have our members do their mammograms in October because it's $99 during breast cancer month every year.
Oh.
Yeah,
okay.
so it's kind of like having the inside scoop on the way to make your healthcare affordable.
I have another one.
Most medications are under $20 at our practice.
What about colonoscopy?
Yeah, colonoscopy is a good question. So again, same thing, we go directly to the GI specialist and say, what's your best cash rate? And I did that with all of the GI specialists in town, and I referred to the one who gave me the best rate. So I have to check 2026 just to make sure they didn't go up, but 2025, it was $1,600 for a cash colonoscopy. Most of my members, if they're, every insurance plan is different, they get much larger bills if it's not covered. But yeah, that includes anesthesia, the GI specialist, the workup, the follow-up, everything. So they give us a one set rate. Again, also we talk to our members if they're a low risk colon cancer, if they have a low risk colon cancer risk, then we also talk about if Cologuard is a good option for them as an alternative to colonoscopies, and those are only $500 cash.
Okay, thank you.
Testing,
Is it working?
testing. I can yell now.
Yeah.
Okay, who else? Yes. Ooh. Having a 42-year-old daughter, I know that this is a very primary conversation that you've given. But for those of us that are 60, 70, and beyond, what does hormonal health look like at that level?
Yeah.
What's normal then?
The interesting thing about that is it doesn't matter the age, it still can impact you differently. Typically with menopause, within the first 5 years of going through menopause are where women experience symptoms the most. Studies show that after 5 to 7 years, most women will not experience symptoms anymore, but everyone's different and patients don't follow the book. So in your 60s, your 70s, what I see the most in women that are 60s, 70s, etc., if they're still having sex, which that doesn't mean you're not having sex, then they may notice more vaginal dryness, they may notice more pain with sex, so then we may talk more about vaginal estrogen just to help the tissue stay moisturized and soft. So it really, again, it depends on how is your 60s, 70s, 80s, how are you feeling, and then we customize what recommendations may be specific for you.
Yeah, I was just wondering if there are now more correlations between health and illnesses in those decades that start at the 40-year-old, when your body starts changing.
Well, the main thing is chronic disease prevention and reversal. So, the things we're doing in our 30s and 40s is setting the stage for the 50s and 60s. If you're eating like trash early, it's going to be hard to just clean it up and do lean and green later in life. We're talking about bone health. We're talking about longevity, right? So being able to sit down and get off the toilet without needing a walker. So it's a lot more about osteoporosis screening. It's a lot more about that strength and resistance training, your vitamin D, your calcium.